the Ask Dr. Tommy O Show. The Ask Dr. Tommy O Show takes a holistic approach to our community's healthcare needs and concerns. Today's show is all about HIV and its secondary disease. Well, let's get right into the show because this is very important. So I'd like to introduce my guest, my pastor, our pastor, Bishop Timothy Burkett. Bishop, welcome to the Ask Dr. Tommy O Show.
Well, thank you, Dr. O'Brien. You know, I asked Dr. O'Brien folk to do this show because I heard so much about the work that you were doing with victims of HIV/AIDS in Brooklyn, and how many people were coming in and being treated, and successfully being treated. I won't say they've been healed, but their conditions have gotten better, or they've been able to sustain their situation with AIDS. And I said, and I called you and I said, listen, it's time for other people to know about what's happening in that Brooklyn medical office.
Right.
And then we discussed the fact that there are many questions that a lot of people have, and I got a whole bunch of them here for you. So I'm going to start out by going into what is HIV.
Right. Well, before we do that, I just want the audience to know that this office was inspired by you.
Thank you.
Because there's a need. We spoke about having voids in the community, and the bishop and I, we're here to fill those voids, and we've done that on numerous times where we're the number one, the first person to take the challenge, and we fulfilled the needs of our community. This is another situation where the bishop and I felt that there was a need, and actually the bishop, he took this project on and he called me to take it over, you know, because being as the physician, because it is a medical office.
That's right. Mm-hmm.
So I'd like to thank you, and being, because I am a community member, we're able to offer this new office and treatments to our community.
Well, many of you know Dr. Tommy O from his medical practice right here in the Bronx, and he's become famous with Ask Dr. Tommy O's show. And so when the challenge came and they said, we need somebody to deal with this dreaded disease, somebody who's committed, somebody who can be able to handle the kind of patients that are afflicted, I said, the only person I know is Dr. O'Brien. And when I asked him to do it, he was willing. And so I want to thank you for really accepting this challenge. And it was a challenge.
Right.
We both know it was a challenge.
Right.
But that challenge has turned into something great out there in Brooklyn. And hopefully we're going to have the same medical practice for you, victims of HIV/AIDS, here in the Bronx and in Manhattan.
That's correct.
But can we ask some questions now?
Okay, let's do this.
What is HIV?
Okay, this is a good starting point. Let's just define what HIV is. HIV, human immunodeficiency virus. Okay, that's HIV. What HIV is a virus that is contracted. How is it contracted? It's either contracted through sexual contact, through bodily fluids, through sharing of needles. Not now, but in the past through blood transfusions. We really cut back on that because of the screening process. But you contract the virus through bodily fluids. What this virus is what we call a retrovirus, where it enters the body, and once it's in the body, it enters the cell, kind of like backs its way in, backs its way into the cell, and it uses the protein synthesis to produce it. And that's where the retro comes, because it works itself backwards, and it's produced through our own body's mechanism at a cellular level. So that's what HIV is. It's a retrovirus that uses the cellular mechanisms to mass produce itself.
I'm going to ask you a question about the word AIDS, because many times people say HIV/AIDS, but they're two separate issues. Am I correct?
That's correct. One is a syndrome.
Right. Okay.
AIDS is a syndrome, and that's what the S is for. AIDS is a secondary, or what we call sequela of HIV. Now I'm going to say something very important, and follow me. You can have HIV but not have AIDS. If you have AIDS, then you have HIV. Okay, did you hear me? Very important. You can have HIV and not have AIDS. Conversely, if you have AIDS, then you have HIV. Because one's a syndrome, it's a secondary or tertiary infection secondary to the HIV virus. An example would be PCP pneumonia, Kaposi's sarcoma, which is cancer of the skin, Candida, when you have the yeast infection, or the thrush in the mouth, and there's other infections that are secondary to the HIV virus.
Right. Now, how many New Yorkers really have this affliction?
Well, it's pretty significant. We are the leaders. The exact number, that's difficult because there's individuals that are walking around that have the virus and don't even know have the virus. There are individuals who have passed away. 4 years ago we had, it's 5 years ago. 5 years ago we had what's called a killer strain, where the individuals were infected, and within like 2 months they died from it. That's how aggressive it is. But getting back to your question, how many? It's significant. We are the leaders, unfortunately. The South Bronx, certain areas in New York City, Lower East Side, certain areas of Brooklyn, are the leaders in the nation, and specifically the South Bronx is the top in the nation. So that's pretty significant. I'm not giving you a number. All I'm saying is that is the leader in the nation in New York City.
Right. Now, the patients that come to you, your office in Brooklyn, that you've been treating, they come to you because they know what they have. Am I correct?
That's correct. They are referred to me by other physicians. Specifically the PCP, the primary care physician, and infectious disease doctor that treats the HIV. Both doctors can treat HIV. When I had my office in the Bronx here, I was the primary care physician, a family practitioner, and I was treating HIV. In the Brooklyn office I have right now, I specifically focus and specialize on HIV treatment, which we're going to cover in the show.
Right, because your success in Brooklyn is really phenomenal. And it's not so much success in the medication that you give, but how you give the medication.
Right,
and how you deal with the people. I'm going to deal with that a little later, because I think we need to clear areas of how do you diagnose HIV? Right.
Well, we diagnose HIV through blood tests. There are other forms you can use. We have a quick rapid test where you can do a swab of the buccal mucosa, that's the inside of the mouth, inside of the cheek. But the standard that I use is we do a blood test. And we do a titer, and then we do a secondary, a Western blot. And that test is a confirmation test, and that's done automatically in the lab. So a patient will come to me and will ask, I'd like to have an HIV test, a screening, and we would draw the blood, send it out, and we would do the test. If the test was positive, the lab automatically does a confirmation. It's called a Western blot. And just to be on the safe side, a Western blot, B-L-O-T, a lot of people misspell that and they think it's block, or, all different ways to pronounce it. Blot, B-L-O-T, is just a fancy name for a test, and it's a confirmation test. And if both are positive, then you definitely are positive. I just want to clarify, there are times where you can have a HIV test positive and a Western blot negative, and it doesn't mean you have HIV. You could have other diseases that can cause a reaction, and then if you do a follow-up test, depending on the lab, they might say repeat the test in 6 to 8 weeks, and it comes back negative, or medications. Yeah. So that's why we always do a Western blot to make sure confirmation. So there's no false positives.
Well, this is good because a lot of people, they get the first test and it's not conclusive.
Right.
But for you to go one step further, I think is noteworthy, to make sure that the diagnosis is complete.
Right.